Hi everyone, Dr. Peterson here with Regions EMS for another COVID update. Today is Friday, December 4th, 2020. As usual, the information I'll be presenting is the best information as I have right now, but is definitely prone to change in the future. Today we're going to talk about vaccinations. I know a lot of you have questions about that. So let's get into some of the data so we can get caught up. Currently, as of yesterday, worldwide, there are 65 million confirmed COVID cases with 1.5 million deaths attributed to COVID-19. As you can see in the US, we have just over 13.5 million confirmed cases with 270,000 deaths related to COVID-19. And if you look at where the current hotspot is, just like the last update, you can see right here, the darker color is a higher density. So the upper Midwest. In Minnesota, we have breached 100 cases per 100,000 individuals, which is currently the highest positivity rate in the country. Most of the lighter blue states are in the 30s, 40s, 50s. The states around us are closer to 70, 80. So we are definitely having a pretty large outbreak right here in Minnesota as we speak. That's as far as the 7-day rolling average goes. In Minnesota, we have 333,000 confirmed cases with about 3,700 deaths related to COVID-19. And next door in Wisconsin, you're dealing with about 400,000 confirmed cases, but just slightly under on the deaths at 3,500. So now that you're all caught up, just a couple announcements, EMS related, before we get into some of the vaccination information. First of all, unfortunately, the ECMO program is going to have to go on hiatus again. Because of the shortage of ICU beds in the Twin Cities, they're just having a harder time ensuring that there is an available bed for a patient needing ECMO services. And it's really difficult and irresponsible to invest a lot of equipment, time, resources in somebody that we aren't able to manage or maintain beyond the initial procedure. So they made the very difficult decision starting Monday, December 7th at 7 a.m. to suspend all pre-hospital ECMO activations, and we'll reevaluate probably later in the first quarter of 2021 once we get through this next wave here and free up some hospital space. Also, just a reminder that St. Joseph's Hospital is set to close here in about 3.5 weeks at the end of the month. The ER will no longer be receiving ambulances or providing emergency services. So they're still a licensed hospital as of right now and still capable of managing emergency conditions, but just know that that will be changing and there will be more to come on that as well. We just got through Thanksgiving, and inevitably, just with the current spike that we're seeing, we fully expect to see another surge here in the next week or two related to gatherings that occurred on the previous holiday weekend here. So just be on the lookout for that. Stay vigilant, protect yourself, social distance whenever possible, especially at the stations when you're eating. Wear a mask at all times when you're around other people. And just have a very high index of suspicion for anybody with any respiratory or infectious symptoms, patients that you might encounter. All right, so the CDC has issued some updated quarantine guidelines. And what I'm going to tell you is not necessarily what your city or agency is going to follow, because each entity has to make their own decision. But the CDC is considering shortening some of the quarantine guidelines from 14 days to 10 days in most cases, or possibly even 7 days with a negative test. With the caveat that you have to understand you may potentially still be infectious up to that 2-week mark, but we're just finding that the vast majority of cases being transmitted are within that first 7 to 10 days. So it's still prudent to be extra cautious if you've been exposed for up to 14 days. But officially, the quarantine recommendations are probably going to drop to 7 or 10 days, depending on whether or not you can get tested. Now, that obviously doesn't apply if you become symptomatic. Then you definitely need to get tested and isolate yourself until you get the test result back. So that's good news for the quarantine. Again, you're going to have to work with your city or your agency to decide what they are going to do with that information. Also in healthcare, a lot of organizations are dealing with critical staffing situations, which means that even if you were exposed, as long as you're asymptomatic, you may be allowed to come back to work, knowing that you would normally be on quarantine, but because of the need for boots on the ground and people to be at work providing care, there may be some instances where it may be appropriate to continue working even though you were supposed to be on quarantine if you are asymptomatic. So again, those are agency or city-specific decisions that you'll want to look into, but that is the guidance that is out there currently from the CDC. All right, vaccinations. That we are on the cusp of having widespread availability of vaccines for COVID-19. There is the Pfizer product that's coming. We have a Moderna product and then an AstraZeneca product that are both, all three of them are imminently ready to get their emergency use authorization from the FDA so we can start administering them to individuals. These are going to be distributed on a national coordinated basis. So this isn't just going to be like the flu shot where you can just show up and get a flu shot. The CDC is recommending several tiers of people who will get vaccinated first based on your risk and your exposure to others with possible infection. The goal is to stop the spread in both the most vulnerable and the highest risk people first, and then kind of work our way down to the otherwise healthy people who are really isolating and able to work from home and don't really have any high risk exposures. There has been some media reports about whether or not first responders will be included in that first tier. Ultimately, it's going to be up to the state as to how they implement the CDC guidelines. But emergency medical services, frontline healthcare workers are included in that first tier. So if you work for an agency that provides medical transport, EMS services, then it is very likely that you will probably be in the first tier. That said, Minnesota will be getting a limited supply. This will be coming in waves. We expect just under about 50,000 doses to be available initially, possibly even within the next week or two. So obviously those will be doled out based on the state and who they determine would be best served by getting those vaccinations first. And then as we get more waves in the coming weeks and months, we'll be able to start working through the various tiers and then ultimately make it available to the general public once all of the essential workers, healthcare workers, and high-risk vulnerable populations have been vaccinated. A couple things to note about the vaccine. The first one to be released is going to require 2 doses. It sounds like they're about a month apart. You do have some protection after the first dose, but really the best protection after the second dose. There are side effects to some of these doses. It sounds like up to about 15% of people will experience not necessarily severe symptoms, but just some more significant symptoms. And it sounds like, just a very mild case of either the influenza or the COVID-19. And yes, I just said the influenza, the COVID-19. You'll feel some body aches, some fatigue, possibly a sore throat, and those symptoms can last for 2 to 3 days. So part of the reason I'm mentioning that is it will be important to coordinate when you get vaccinated to make sure that you're not going to put yourself out of duty basically for 3 days after you get the vaccine. You're probably going to end up sacrificing, several days of a long weekend or one of your off segments or long stretches off so that you can recover from the vaccine and not have to call in sick or quarantine, because obviously you could still get the virus even after you get the vaccine. So the side effects and the administration plan right now, it looks like it's going to be at the county level. The county public health departments will determine how to distribute these and how to administer them, obviously in partnership with a lot of other healthcare organizations and agencies. And it's possible that the National Guard may be involved, or even some of you may be asked to step up and be vaccinators and help vaccinate some of those people who are going to be getting this vaccine in the first wave. This is a big step forward. The data right now, efficacy of these vaccines is greater than 90, in some cases 95% effective at preventing the vaccine. I mean, those numbers are unheard of in vaccines. If we look at the flu shot, which is more in the 50% efficacy range. So this is really exciting. Hopefully this is a huge step forward in limiting the spread of this disease. And then we can eliminate this pandemic and just kind of get back to our normal lives here. Get the kids back in school, get everyone back at work, and get our society functioning again. Just in time for our brief hint of sunlight next year, 2021, during the summer months here in Minnesota. That said, there's a lot of information right now from the CDC, the Minnesota Department of Health. We put links to those on our COVID page on our website, regionsems.com. You can click on the COVID link at the top and see everything that we have produced and organized for you. So review that on some of your downtime. There's a lot of useful resources and information there. All right, regarding last episode's trivia question, the question was which pandemic in the last 100 years has caused the most deaths worldwide? It was kind of a trick question because I said in the last 100 years. A lot of you submitted the Spanish flu outbreak of 1918, but if you do the math, that was more than 100 years ago. I will say that the duty crew at the Lake Elmo Fire Department got it right. Let me see. We had submissions, Nate from Lakeview, Ross from Woodbury, Brad from Lake Johanna, Brian Mueller from Washington County, soon to be Stillwater Police, Gail from Marine Fire and Rescue, Matt from Lakeview, and then let's see, Dawn, don't have a, looks like a Ramsey County email address there. So Gail from Marine Fire and Lake Elmo Duty Crew got it right. It's actually the HIV/AIDS pandemic. We don't think of it as a similar pandemic to what we're experiencing, but it is technically a pandemic. It is still ongoing and has been for the last 30, almost 40 years. So we will see many more deaths linked to HIV/AIDS. But that was the correct answer. All right, moving forward for next episode's trivia question. We'll go a little Hollywood here since we're not getting a whole lot of Hollywood from anything else right now. Which virus inspired the movie Contagion? I'm just going to leave this one open-ended because I think with some quick fingers and a Google search, you can find the answer on your own. So thanks for watching. Thanks for tuning in. Send us any feedback, comments, questions to regionsems@healthpartners.com. We'll do our best to address them in future episodes. But otherwise, thanks for watching. Stay safe. We'll see you next time.